Okay, picture yourself on a table similar to this, your sophomore year, with dreams and ambitions way far ahead of you. And then being shown these three pictures. This was actually me the other day. The picture on the far right side is a picture from over a year ago when I was a sophomore, and I did not believe that was my spine. The picture in the middle is a picture from 6 months ago, and a picture on the far left is a picture from the other day. Scoliosis is what you would call that ugly picture. And so this is my story of how scoliosis has affected me, and I did not let scoliosis define me. I defined scoliosis. So as a table of contents, we are going to be talking about what scoliosis is and how it affects different people, how to be diagnosed, and what are the options for you to decide after diagnosis. So scoliosis to me is mentally damaging only if you let it. It is a physical issue, and it creates curves in the spines that could be a S shape, a C shape, or the rotating of the vertebrae. So according to treatingscoliosis.com, there's early onset scoliosis, which is scoliosis that affects ages younger than 10 years old. And so this can either be very severe or very not severe. So typically kids at below the age of 10 would be put into a brace, but bracing only works if it is done correctly. The second frame of diagnosis is adolescent scoliosis. That is when I was diagnosed. And so it's kind of a waiting game to see how far your spine has developed, or if you're going to be stopped, if you have already stopped growing. And so I was first diagnosed in 7th grade, and it was only mild at that time. And then during my sophomore year, it progressed rapidly, and my spine needed treatment then, or I'd have to wait throughout my high school career to have a spinal surgery. But my back, there's a lot of pain that goes on in your back, and I mean, it's kind of important to you. And then last, there's degenerative scoliosis, which affects the older population, and it is normally shown in the casual C shape in elders. That happens when their vertebrae have lost their joint tissue and stuff in that matter. I was diagnosed as idiopathic scoliosis, which means that there's no known cause. Then there's also congenital, which means it shows up as a birth defect. And then there's also neuromuscular, which means it is after a brain disease or a muscle disease. Moving on to how you get diagnosed. When I was in 7th grade, I was told to do the Abbigale bend test, which basically means you bend over and reach your toes, and the doctor looks for physical deformities in your spine. There is also different x-rays that you can have done, and they will take a measure of Cobb environment, and it shows how far along your scoliosis has progressed. Mine in my sophomore year was at a 52 degree, meaning that's on the borderline for surgery. Anywhere between 45 degrees and 55 degrees is when you would have the spinal fusion, which is the surgery. For spinehealth.com, most doctors use a scoliometer when you do the Adams bend forward test, and so that shows and helps them out on how far along your scoliosis has progressed. Other things that you could use to diagnose yourself would be physical attributions, meaning like your ribs are uneven, your hips are uneven, your legs are uneven, your shoulders are uneven, or you just appear as a tilted person. What you can do about scoliosis is there's multiple things that would fit to your personal needs. What happened to me was I decided to have a spinal fusion, which means that they fuse all of the vertebrae in your back to one bone. So I had 2 rods and 18 screws in my back, and they fused it from the top of my spine all the way to L3. If they go anywhere below L3, which is your lumbar, it could be difficult for your mobility to function after your surgery. Other types of things that you could do, typically for younger kids, would be bracing. But bracing, if you if you have to have a correct brace, because otherwise you would basically be locking the spine in place, meaning that your spine would not get better, but it also would not get worse. So it's a big issue for doctors all around the world trying to target the things that contribute to scoliosis and how it progresses. For me, I think one of my major issues was when I was growing up, all I did was cheer and all I did was tumble, and so that's a lot of pressure on my back. I got into weightlifting and I got into tumbling anywhere and everywhere I got to be. That was what I was known for, I think. And so the uneven pressure on my back caused me to have a Poly's defect, which is a fracture on both sides of the vertebrae, causing me just to slip forward. And that was really painful, if you could imagine a fracture in your spine. So getting treatment for scoliosis is really important, especially if you have pain, because you do not want pain to be progressing. You do not want pain to be progressed over the years of age. Another thing to work on is to just train your body and have better posture overall. If you catch it at an early age, and according to scoliosiscarecenters.com, you have to identify the factor that causes your scoliosis, and you have to figure out a game plan to treat your scoliosis. A spinal fusion, for me, it took 9 hours and 20 minutes, but it's supposed to take anywhere between 6 to 8 minutes. And my doctor, I had Dr. Jensen at Children's Hospital, and it was really hard for me to take a pause on my life at that point. It was really hard for me to say goodbye to all my dreams and ambitions of being a college cheerleader. So to stitch things up, to me, scoliosis isn't the end of the world. Scoliosis has opened my eyes to different possibilities, and honestly, it has made connections. Like my friend Caitlin Eckner, she graduated last year, and she had scoliosis, and she had a spinal fusion done when she was much younger than when I had mine done. And so scoliosis can affect you only if you let it, and scoliosis is a curve in the spine, and it could affect any person, doesn't matter their gender or their age. It could happen to you. Then we talked about how you can diagnose yourself by looking in the mirror or going to the doctor and what the doctor usually does. Then we talked about how you can train your body and fix the issues of your spine, knowing that it should not affect your mental abilities to move on with your life, because you shouldn't just stop. You should always continue moving. And that's what I did, and that's what you should do if you ever do a spinal